Hi, everybody. I'd like to thank you for coming on this webinar call. My name's Simon Ramshaw. For those of you that don't know me, I'm a managing director of UK-based Erchonia Lasers. We're a subsidiary organization of the US company Erchonia Corporation, and we look after their interests in Europe, the Middle East, and Africa. So thanks for joining the call with Robert Sullivan from Middleton Laser Clinic in Ireland. The title of the talk is Beauty is No Longer Skin Deep, and it follows on from very successful webinars Rob's done for us so far, including Introduction to Non-Thermal Low-Level Lasers, Theory of Cellular Interaction, and last week's, which was a light approach to fat cell management. So if you guys weren't on those webinars or you weren't registered and you would like a copy of the video, then let us know and we'd be more than happy to send it on. So we got a good spread of attendees from different countries around Europe and a couple of the Middle East, which is good to see. Obviously, we'll be happy to assist you at the end of the webinar, which for reference will actually be recorded and it will be sent out to all attendees and others who are registered who maybe couldn't attend. We'd also like to alert you to the question and answers box on the right-hand side of the screen. So please feel free to type your questions into that box as we go along. And then after Robert's finished his lecture, we will ask him the questions and I'm sure he will answer them to the best of his ability. Right, we better move on to Robert. Rob's got a really impressive resume. I've known him personally since 2012. He's a podiatric surgeon. He's a scientist and researcher who's actually carried out quite a few studies independently and for us, including fungal nail infections, diabetic peripheral neuropathy, pre-diabetes in obese patients. And for those of you who are interested, he's recently wrote an article on viruses and boosting the immune system with non-thermal low-level laser. And we're more than happy to send you this article if you would like it. He's a national and international speaker, both for us and for other organizations. And Robert has a reputation of thinking outside the box and trying to progress his scope of practice. So his special interests include non-thermal lasers, pain management, fat cell management, and immunology. So without further ado, Rob, across to you.
Thank you, Simon. My current interest is, or was, trying to plan for my retirement in 2021, but this COVID virus is going to change a lot of that. Anyway, thank you for joining me again for more on lasers. This lecture is basically called Beauty is No Longer Skin Deep, and what we're going to do with it is we are going to look at the positive health benefits that come from using Verju, Zerona, and pretty much non-thermal low-level lasers generally. So a lot of what I'm going to say today is part recap from the previous lecture series that we've been doing. And for those of you that haven't heard any of those, then it's going to bring you pretty much up to where we need to be for today. So what we're going to do first of all is just a recap on the previous lectures. So it will be a brief overview of Verju and Zerona from last week's lecture and an introduction to the positive benefits that this type of non-thermal low-level laser technology brings. I've worked with a lot of lasers over the time, but this is the only laser that I would use as my go-to device. When we've done that, we're going to take a look a little bit more at the whole concept of beauty no longer being skin deep, because when we use a non-thermal low-level laser, we facilitate a cellular interaction, and the body is able to do a lot of things with this interaction, from restoration, rejuvenation, immune building, etc., etc. So we're going to take a little look at the science behind that and a couple of hypotheses around there. From there, we're going to move on and we're going to look at the positive effects of 532 nanometer and 635 nanometer non-thermal low-level lasers. And basically, the effects that this technology has in terms of its design, but also the far-reaching global health benefits within the body created as a result of that intervention. So then, as the conclusion, I have a number of conclusions, because at the end of this, I'm drawing in research from a number of areas. So the conclusions that we're going to make is pretty much, is non-thermal laser as good as we think it is? Is it as bad as some people would say? Or basically, is the research correct? So I can only speak to you from my own clinical evidence, because those of you that know me and research, we can pretty much make research say what we wanted to say, whereas clinical evidence speaks volumes. So the recap. Sorry, jumping too far. So the recap, basically, we're talking about non-thermal low-level lasers. And these lasers work from the visual light spectrum. And the visual light spectrum, we used to say 300 to 9. Now, basically, we say 400 to 700 nanometers. And basically, a nanometer is the distance that light travels in a second, which is quite a long way. So when you look at that chart there, if you look at the picture on the right of your screen, you will see that at 400, the wave is closer together. When we get up to 700, the wave is further apart. As we're closer to 400, you're getting more energeticity within the wave. And as you get further away from it, you're getting less energeticity of the wave. And just to recap for us, the laser is a delivery system for photonic energy. So when I fire up my laser, and the important thing about these non-thermal low-level lasers is we use the minimum possible amount of energy to generate a stable, monochromatic, coherent, columnated laser beam. And once we have generated that beam, because it's non-thermal, it doesn't have a target. It's going to keep going all the way through the person that we aim it at. But what we then do with that is we're going to piggyback hertz of light onto that beam, which are delivered into the body. So the laser will go all the way through, the beam will go all the way through, but the light that we're putting into the body won't, because that's going to be absorbed by cells. Last week, we spoke about fat cell management, and fat cell management is very important from a number of point of views. It's important from the health benefits that we get from managing our weight, and it's also important in terms of what our fat actually does for us. So just to recap on last week, when we put a non-thermal low-level laser, in this instance the Zerona, on it, it basically causes the fat within the fat cell to emulsify. And when that fat emulsifies, it is then expressed out as free fatty acid into the lymphatic system. And because we have told our patients to irrigate themselves properly or be properly hydrated, that fat within the lymphatic system is carried as potential food for muscular action. It's also carried in that fluid for excretion through phagocytosis, as we said last week, and anything that's remaining will be restored into the fat cells. And that's very important because a little while ago, World Health Organization recategorized our fat cells as part of our endocrine system. So because our fat cells are part of our endocrine system, it's important that we don't damage them, that we don't break them, that we don't explode them, that we don't cause them any trauma. Because if we do, that's pretty much the same as me causing trauma to my liver, because my liver is part of my endocrine system. So the importance of maintaining the health of the fat cell can't be overemphasized. And of course, this is not just true for the red laser, it's also true for, as you see there, laser's gone green, for the green laser. Of course, the green laser, as we said last week, is 25% more efficient, but as well as that, it is very clever in the way that it works with collagen, which basically helps us to pretty much control and make a person devoid of cellulite over a course of treatments. So, what does all this mean? It's very important when you think about the way that these lasers work, because their primary target is the mitochondria. And within the mitochondria, we have cytochrome C, which is a water-soluble protein, hence the importance of water. And everything happens as a result of that mitochondrial cytochrome C interaction. So when we look at the literature around the mitochondria, we find lots and lots and lots and lots and lots of information. So what I've done with this presentation is I focused on the 6 most recent, but as well as focusing on the 6 most recent, when you look at these papers, you'll see that some of this stuff goes back to the 60s, which is pretty much when laser itself started being used back in Semmelweis University. So when I was teaching, we used to look at the mitochondria as being energetic factories or storehouses of energy for the body. And because of the research now, we know that that is not just the case. We know that the mitochondria performs a lot in terms of intercellular signaling. And when we talk about intercellular, we have to think of inside the cell and outside of the cell. So what we're talking about here is it facilitates communication between cells. We already know that the mitochondria facilitates communication within the cell itself, and that's what we originally thought, whereas now we know that it also facilitates that communication and signaling outside of that. We know also that it's very important in regulating our innate immunity, and if we have mitochondrial dysfunctions and conditions, then that regulation of that innate immunity is lacking. We also know that it hugely regulates the activity and the production of stem cells. We also know from research that when we think about stem cells, the older we get, the less of them we have that function adequately. So when we look at each of these properties, it provides for us a clue in how important the mitochondrial regulation is within aging of cells, aging of the body, and age-related diseases, as well as the accumulation of weight as we get older. So when we look at cellular aging and why we age, we have to think about our predisposition to that. And as you saw in a previous lecture that I did, one of the main guys involved in this whole hypothesis around aging was Madawa, and he was interesting insofar as his hypothesis and his research pretty much showed that when we're born, we have good immunity, and we maintain this good health, this good immunity, this good cellular activity, this good communication, this good biological control until we hit a certain point. And that certain point is reproduction or sort of replication of the species. So when a human, male, female, gets to that reproductive point, all of our cellular activity is designed to maintain us in our optimal state until that time. When we have basically performed this act of procreation of reproduction, our cellular activity changes and our immunity begins to change, because what basically happens is no longer are we focused on performing that act in our perfect physical prowess. We now can fall into a different state. And pretty much this was his whole hypothesis. And when you go further, if you were listening to Simon at the beginning, you'll hear that he is from the more northern part of the UK. So up near him, we have Tom Kirkwood, who basically still works in the University in Newcastle. And his theory basically was about pretty much the decline of somic energy. And when somic energy declines, basically the body goes into a different mode of activity. And he basically puts that somic change, again, similar to Madawa does, around that age of reproduction and procreation of the species. So when we look at the mitochondria and what it does, we basically see that it has a huge interplay into the way that these somatic cells basically function, how they age, how they change. The paper that I'm citing there, you'll be able to see when you get a copy of the presentation. You can download them. I tend to use pretty much open access papers so that everybody has access to them. So basically what this is saying is that stomach cells and their production changes as a result of aging. So as we age, we don't have as many. But also as we age, what basically happens is our ability and our immune remodeling also changes. And for a long time, it was a case of scientists didn't know why this changed, what this change was. Now we're basically seeing that it's because of mitochondrial action and changes that the mitochondria bring about even within themselves. And simple things like this paper is saying that we take for granted, graying hair. Why does my hair go gray? Lots of money has been thrown at that over time, and we still don't pretty much have an answer to that. And then the other thing that we're looking at is damage, DNA damage, mitochondrial DNA damage, mitochondrial DNA misfunction within tissues and even within parts of tissues. So cellular aging. We know, as I have said, that it leads to profound effects pretty much within every system of the body. We know that as we age, we get muscle wasting, we get muscle weakening. We also know from the paper I just showed you that we get graying and we get hair loss. All of these things still not that well understood. We know also that we get impaired immune function as we age. So after we've hit that point of, I suppose, propagation of the species, things change. And aside from this, there's been some interesting research done around celibacy and people who live religious lives and don't have kids. They tend to age better. They tend to live longer. Now, we could say that that's a biological event, or we could say it's a psychological event brought about by the art of marriage and cohabitation, but we won't go there. So what is the evolutionary basis of aging? So as we saw, basically, Madauer had his hypothesis, Kirkwood had his hypothesis, and basically, are we genetically programmed to age? I think when you look at the research, we can see that we are genetically programmed to age, because like anything, be it a washing machine, a clock, a person, we have this life expectancy beyond which functionality will cease irrespective of the interventions that we make. So can we change this aging? I think if you followed me on the course of these lectures, you can say we can possibly change aging in a biological sense by allowing our body's cells to go into that restoration, rejuvenative state, which is a byproduct or side effect of the use of these lasers. I think for years we have seen Botox being injected, we have seen fillers being injected. That changes the physical, visual signs of aging, but it's not really changing anything for that cellular aging. So if you bear with what we're talking about and indulge me a little bit more, you'll see that what these lasers do is bring about that internal beauty that reflects what we can do externally with a bit of fillers and a little bit of Botox. So Madauer's hypothesis, we've already gone through, is basically, it's an accumulation hypothesis. So basically, when we hit that certain state, because of accumulation of change within cells, within tissues, then basically we reach our demise. And then we have Kirkwood and his disposable thoma theory, which was always good for a bit of impromptu science. So when we look at the mitochondria, basically, it's the only thing, shall we say, cell within the body, which is hugely linked with the energy of youth, but also linked with the decline of age. Because when you get a chance to have a read of those open access papers, what you'll see is that as we age, we lose mitochondrial function in terms of synthesis. So we get mitochondrial DNA. Basically, we don't have as viable number of mitochondrial DNA as we did when we were 6 that we have when we're 60. So that's basically the energetic side of the mitochondria. So our energy is lessened because we have less mitochondria. So as a result of that, because of the signaling and the communication that we talked about earlier, other cells are affected by that. So we see decline in other cells, in specificity, in methylation, and in basically the ability of the body to produce stem cells in any amount which is viable for change. So the other thing that we see with the mitochondria is basically it has very complex antagonistic functions, which are interesting in terms of the whole chemical process within the body. So the research that I presented to you basically transforms the way that we would have viewed the mitochondria in the past. So the relevance of the mitochondria in aging, it's not new. It's been around for a long time, but the extent to what effect that has not been understood that well. So when we look at the reference there, we'll start with looking at the reference. When you look at that 1963, mitochondria was associated with aging, but 2003, this is where we start to see the big changes. So during aging, we see an accompanied decline in mitochondrial function, and this contributes to a lot of things that we see. So things that we already discussed, like the muscle weakness, the aging, etc., etc. There's also now a perceived link between it and specific specialized types of cancers, which is not the remit of this lecture, but we could look at some stage in the future. So as I've already said, as we age, these mitochondrial mutations increase. They increase more frequently. So as we age, again, the increase is more. And also the levels and the kind of mutations that appear in tissues and in different tissues and even within the same tissue basically contribute to aging and age-related conditions. Again, you can see there 1988, 1989, 1990, 2002, 1992. All of that will again reference into the latest paper there that Peterson did in 2003 and one that he's just published. Of course, presenting any research is important, but you also have to look at the counter argument to that. And for those of you that care to read it, there's a very good counter argument there. So the mitochondrial basis of aging is not really new. This is the latest paper here. I think this is a 2016 paper, and it's by Nierson, and very prolific writer, very, very interesting paper and person to read. So if you're going to read any paper after this lecture, there's the one there that you should go in and read. So as we age, what else happens? Inflammation. So inflammation is probably the thing that's going to get us in the end for various reasons. So one of the hallmarks of aging really is this development of low-grade inflammation. I kind of like to call this inflammaging, and it's characterized really by a lot of things, but one of the main things that is characterized by is an increase in circulating inflammatory biomarkers, kind of our IL and our C-reactive proteins, etc., etc. All of these things basically tell us that we have this inflammaging going on. And the result of that is we get enhanced age-dependent immune responses. So age-dependent immune responses are interesting because, again, our body has done what it was supposed to do, so now we're aging and we get a condition, so the body goes to try and mend, modulate, regulate, change that condition, and while it's doing that, we can get another condition which is far more serious, and the body tends to become more immunospecific. And the reason for that is we get a loss of mitochondrial DNA synthesis, and that brings us back to methylation. So when we look at methylation, we kind of have to think about it in two ways. Is methylation good? Is methylation bad? Like pretty much everything that happens in the body, without balance, it's not good. With balance, it's good. So this, as you may remember from my previous talks, is one of my favorite slides, the human mitochondrial genome. We're all sitting in front of computers at the moment, but you are looking at a computer, and every single mitochondrial genome that you have, every mitochondria you have, 16.5 kilobytes. That's a lot. So when you think about that, and you think about the information that must be stored and contained in that cell, 16.5 kilobytes, how relevant now suddenly does that mitochondria become? And when you just look at some of the processes there, especially like regulation in the D-loop region, when we look at RNA genes, et cetera, the relevance of this small microscopic beastie become more and more relevant. And for those of you that are interested, this is the complete workout of what's going on within there. Again, something that you could look at a later stage. So what do we know from research? We know from research that mitochondria decrease with age. So if we are going to accept that this mitochondria is important in all of the systems and areas which the research now suggests, plus the things that I've mentioned to you, then we suddenly have to look at lasers, non-thermal low-level lasers, differently. Because as we use them, we know, again, from the research, that we'll get an increase in the viable number of mitochondrial DNA because of the use of these non-thermal low-level lasers. So those citations there, again, go have a look at those, and they will speak to you about what happens as a result. So we know that non-thermal low-level laser has a strong beneficial global effect on the body. I think one of the questions that I get asked is, well, hang on a second. How can this laser do so much? How can this laser have such a big effect? The truth of it is, the laser doesn't do anything. As I said to you at the beginning, the laser is a delivery system for photonic energy. It is the delivery system that brings that light into the mitochondria, onto the cytochrome C, the photoreceptor, which basically causes that water-soluble protein to break down and convert ABP to ATP, and from there into free nitric oxide, reactive oxygen species, H2O2. It causes the upregulation of genes, expression of genes, and many, many, many other things as are discussed in the literature that I have presented. So when you think about aging, and you think about these lasers, and you think about, okay, we've just used this for a cellulite treatment, or we've just used this for a fat treatment, you have also increased the viable number of mitochondrial DNA. You have also created a global effect within the body, because through electron transport, if one cell gets excited, that has a knock-on effect in every cell in the body. So even though I may have targeted just the circumference of the body, I am targeting the entire photochemistry within the organism itself. And by doing that, I am having a global beneficial effect. Now, from the research we've already seen, what else is happening? Anti-inflammation, increase of viable mitochondrial DNA, expression of stem cells. And remember, a stem cell doesn't really know what it's supposed to be until it's told what it's supposed to be by movement, action, nerve stimulation, etc., etc. So the importance of these devices, I think you can begin to hear. So the positive effects of 532, 635. What are they? Well, this paper is very important because it basically shows you pretty much on screen, on a diagram, pretty much all of the positive effects that this has, from the analgesic effect through to increased lymphatic flow, which is very important in removing fat from the body, to the stimulation of cell metabolism, to basically the stimulation of microcirculation. So suddenly we have something that is not a drug, that is working within the body as a drug does, but with no toxic side effects, no toxic damage, no second pass metabolic issues. And as a result of that, you have something that is doing good. And I think the problem with any of these things that do good is, I know for a long time, I was used to a patient coming in and I looked at my desk, I heard what the patient had to say, I wrote a prescription and I gave them that. And I never had the satisfaction of seeing the look on their face of how they felt when something went better or they got better, because I only saw them when they were sick. Now, if a patient comes in with a problem, I reach for a laser and I use the laser on them. And for the first time, I get to feel like a medic because my patient says thank you, smiles, and walks out feeling better because of the positive effects that we see on the screen, which were basically listed in this recent paper, the biological effects of low-level laser therapy, which is basically non-thermal low-level laser therapy. The reason that I say non-thermal low-level lasers is because some thermal lasers can be cold, some cold lasers can create thermicity and be hot, but the lasers that I'm talking about, they can't. They are completely non-thermal, completely low-level lasers. So as I've said, laser light, the new drug, with no adverse reactions. First lasers were used really in the 1960s, mid-1960s, by Mester in Semmelweis University in Hungary. As I already said, this guy was doing an experiment on mice, and for some strange reason, his experiment involved the shaving of mice, and he was going away for the weekend and needed to keep his mice warm. And he stumbled across what he thought was a heat lamp and turned out to be a ruby laser, hung it up over his mice, and his other mice that he was using in his experiment for control, he put a normal heat lamp over those. When he came back after his Easter break, his hairless mice had grown hair and were quite happy, and his warmed mice with hair were quite dead. And from there, he started working in trying to heal diabetic conditions and stuff like that very successfully. From there, lasers went into pretty much animal usage and jumped back into human usage again in the 90s. So laser basically works like a drug, as we said, with no adverse reactions because it recognizes and it reacts with molecular receptors. So basically in this instance, that's our cytochrome C. It activates secondary cascades within the cell, so adenosine bi-2-triphosphate and the other chemicals that I've spoken to you about. And that's also very interesting because in the paper that I recently wrote on immunology that Simon alluded to there at the beginning, I did a lot of reading around lasers being used, non-thermal low-level lasers being used in HIV. And they were being used along with the standard drugs, but they were helping to get people into this undetectable state. And the reason that they were doing that is oxidative stress. So think of what happens when we use a laser. We switch on the laser, we shoot it, it penetrates the body, the light is taken from that by the photoreceptor cytochrome C. And then the next thing that happens is we see a release in free nitric oxide. And then we see a release in reactive oxygen species. Now, if we're not careful, what we actually see is a cell going into stress. And as that stress increases, we get oxidative stress. And the reason that lasers are used in treatment to reduce viral loading is because what's the next thing the laser produces after it's produced this reactive oxygen species, this free nitric oxide? H2O2. And when it produces this H2O2, it flushes all of that crap out of the system. Oxidative stress becomes less of an issue. So these lasers also affect cell behavior and function because, as we've said, they upregulate genes. But the other thing that we also know is that they prevent unspecific proliferation, and they also downregulate. When I was teaching, when I was taught, it was a case of can't downregulate anything, you can only upregulate it. So you can't switch things off, you can only switch things on to balance what's playing up. The interesting part of that statement is presents proliferation. When you read into Callan's paper on this, it's interesting because his hypothesis is basically that because we have a genome, we have a map, and our body knows exactly what we're supposed to have based on that map. So if we get something that is wrong, a tumor, whatever, we get proliferation of those cells, and we know that lasers create cellular proliferation. So the worry there was that by creating this proliferation, we would actually cause further metastasis of the cancer and cause further damage. What we didn't appreciate at that stage, what he's talking about here, is that the body knows what the body has and the body knows what it shouldn't have. So basically, we don't see proliferation in tumors as a result of the application of non-thermal low-level lasers. What we actually see is the support of the system around that, because after all we're doing is instigating a photochemical process, which is basically laser light, which is in effect a new drug within the system. So what we know. Benefits. So we know that these lasers, in terms of the Zerona, Z6, and its predecessors, and Verju, and what will become the next generation, the Emerald, are used in what I like to call, to the annoyance sometimes of my colleagues, fat cell management. And fat cell management is body sculpting. So body sculpting is something that a lot of these lasers like Zerona and Verju are very, very accomplished at creating. So they can take somebody who's got that little bit of baby belly, or that guy that's got that little bit of beer belly that won't go away, and they can basically allow the person to be rid of that very effectively with very little effort, through a little bit of extra movement, proper fluidation, and the application of the laser. We also know that these lasers are extremely beneficial in weight management. So if you have somebody that's a little bit overweight and wants to maintain it or bring it down, then with a little bit of exercise, some minor dietary management and the application of this, they can do that very effectively. And remember then, if they're doing that with the red laser, it's very effective. If they're doing it with the green laser, it's 20–25% more effective. Simply by its method of action, plus of course the benefits of being able to treat the cellulite. Again, either of these devices, we can put them into pre-obesity management, and we can put them into diabetes management. The whole problem with putting a device into fat cell management is, well, hang on, we emulsify that fat, we release it into the system. Surely we're going to mess up our cholesterol levels, mess around with our HbA1c, and not only that, are we not going to clog up and block up veins and arteries? We're not. And I'll show you the research in a moment. So even though these lasers will work in obesity management, there is a new laser just about to come called Emerald, and Emerald is basically what I would say is going to be the world's gold standard device when it comes to obesity management. Because I've worked with these lasers for a long time and I have yet to see anything that works better than them. I suppose my claim to fame with these lasers was my one task in life when I met Simon and Erchonia years ago was to prove that this stuff's a load of crap, it can't possibly work, and I'm going to prove it. And here am I sitting talking to you, saying to you, no, this really works. It's very exciting the way it works. And once you get your hands on one, if you haven't already, and you start playing with it, you're going to think, life is so simple now. Why was I making it so complicated? And of course, cellulite control with Verju is excellent. What else do we know of the benefits? We know that these lasers have extreme potential in pain management, especially when it comes to musculoskeletal pain, as any chiropractor will tell you that uses them. I can talk to you about neuropathic pain because of the diabetic peripheral neuropathy studies and the fact that we were able to reverse peripheral neuropathy, not only just suspend it, stop it, we were able to reverse it. These lasers as well in general pain management, again, they are excellent devices. And I can hear you already saying, oh, hang on a second, well, what about somic pain? What about nociceptive pain? What about? Well, actually, yeah, what about it? I mean, all your body knows is I have pain. It knows it hurts, ow, or it hurts, oh God, that hurts. That's what your body knows. Your body doesn't know anything about musculoskeletal pain, nociceptive pain. It just knows the quality of the pain. And you've got a laser in your hand that works with the body's photochemistry as a drug that knows nothing except I need to fix that pain. And honestly, believe me, it is as simple as that. Benefits, what else do we know? We can use these devices in neurological management. In my clinics, we use them for Parkinson's. We treat Alzheimer's. We've even had a go with attention deficit disorder and autism. And Simon or Julie can make available to any of you that want it the latest autism study in terms of what these lasers can do. So even though we started off talking about fat management, we're now talking about autism. That's because, like I said, laser doesn't do anything. It's a delivery system for photonic energy, which allows your body to work the way that it was designed to. We even use these in strokes, as if any of my colleagues are on from Romania will tell you, we've done work there with people with strokes, and in less than 5 minutes, we have had huge changes. And of course, there is pre and rehabilitation, which is very important, because if you have a recurrent client with a recurrent injury, and you keep treating the 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 injury, how boring is that? What are you achieving? You're not achieving really anything. You're just allowing this person to mess up something and come back to you. You fix the mess up, they go mess it up some more. Wouldn't it be great if you can take a device and suddenly say to this person, okay, instead of going out and getting that groin strain injury, let's treat it before you go. So now you treat it before they go. That's prehabilitation to prevent rehabilitation. If that person does have an injury again on that, it's going to be far less and far easier to control. And if you prehabilitate them each time before they go, you'd be surprised how quickly you don't have to rehabilitate them anymore. Don't just take my word for it. Go grab a laser and use it yourself. So what else do we know? We know that they are excellent for skin tightening. We know they're excellent for fat loss, cellulite control. We can use them in aesthetic dermatology, and we can use them in dermatology generally. For those of you that have stronger stomachs, I could share with you lots of pictures in terms of that. And we use them in podiatry and in dermatology in dermatophyte management. So dermatophyte management, for those of you that are asking, dermatophyte management is basically fungal infections of the nails, fungal infections of the skin tissue, fungal or mold infections of the nails or skin tissue as well, things like Candida. So I think if you've listened so far, you'll get my next statement. And my next statement is the limitations of these devices are pretty much down to the limits that you place on yourself as a clinician. So if you have one of these devices, don't be limited by what it says on a label, on a box. If you understand the chemistry behind this a little bit, now you can start to see what else you can do with the laser that you've got or the lasers that you're thinking about. I spoke to you about diabetes, and what I want to share with you is some figures from some research that we did in pre-obese patients, well, obese patients with pre-diabetes. And if you look at those figures there, like 6,300, what's that? That was the total weight of the people on the study added together at the start of the study. So we basically took 140 patients, randomized them into 2 equal groups, and at the start of this study, basically, the active group, these are the groups that got the real laser, they weighed in at 6,300 kilos. A lot of weight. The guys in the control group, which basically were treated with an LED, they weighed in at 6,250. At the end of the 18 months, the active group had gone from 6,300 down to 4,850. And the control group had gone down to 5,399. It's important to say that with this study, both groups undertook the exact same nutritional management plan. Both groups undertook exactly the same exercise management program. The difference between the groups was purely one had active laser, one had LED. So because they're all on a good diet, that is weight loss. So when you look at the difference in weight loss between the active and the passive group, you can see that there's a huge difference, because when we put them side by side, the active group lost 1,450 kilos as opposed to 851 of the other group. And that was using the red laser, the Zerona laser. So think now, 25% better with a green one. So conclusions of that study, the conclusions we made of that study was that diabetes is and will continue to be a world issue unless we educate and inform. And until this COVID pandemic hit, diabetes was the most preoccupied medical problem on the planet in terms of what we were doing to ourselves. And we do it every day with a knife and fork. We don't do it with a rope. Some of us do, but most of us do it with a knife and fork. So diabetes is not just about diet. Diabetes is both a psychological and psychosocial problem as well as a medical one, I would argue. And laser is, from the research there in the graph I've shown you, a viable option. Like, we followed this study up for another 18 months after that, and I could share with you the statistics of that. If you want, we can get them sent out. What I would ask you as a result of this study is, if you have one of these devices, or if you're thinking about one of these devices, is there a new role for clinicians in the management of diabetes? with these devices? There probably is. I mentioned to you about a peripheral neurological study. We took diabetic patients who had been diagnosed with peripheral neuropathy. Some colleagues did some nerve biopsies, as you can see there, before and after. If we take a closer look at those, what you're looking at there is, on the left, you're looking at nerve density, not very much, because it's a peripheral neuropathic patient. If you look on the right, look at the change. A laser doesn't do anything. It just delivers photonic energy to the mitochondria, which basically allows the body to have the energy, soma energy that it needs, to make the changes to reverse that condition, to halt it in its tracks. Laser doesn't do anything, just a delivery system. So the conclusions to this study were similar to the other diabetic study, which basically was that non-thermal low-level laser therapy facilitates the regeneration of peripheral nerve tissue. It basically facilitates the regeneration of lots of tissue, elastin, collagen. It allows you to produce more mitochondrial DNA. So diabetes is not the only area where patients suffer from peripheral neuropathy. Immunocompromised patients can develop it. People with nerve conditions like MS, ME, they can develop it in early and mid stages. We have a device that allows us to facilitate the body to make the changes in relation to that. And all pain is social, psychosocial. It's a problem that we can deal with by getting the body to work the right way. So again, laser is a viable option in managing prediabetes and the neuropathic pain syndrome associated with it. And again, conclusions of this study, is there a new role for clinicians in the management of diabetes? Possibly there is. Fat cell management. So if you think about all of this, nobody can make a change to themselves without a beginning. And these beginnings are necessary and facilitated by the laser. I said to you in the beginning, well, what about all of this fat in the system? One of the studies that was done basically looked at that. And it looked at the LDL, HDL, triglycerides, total cholesterol, et cetera, before and after studies. There you can see the results. We can take it further and we can start looking at safety studies in terms of serum chemistry. Again, this article was published in the American Journal of Cosmetic Surgery in 2010. And when you look at it again, triglycerides, total cholesterol, and your low density, when we compare the baseline to the post-procedure and the end, again, you can see huge differences. How healthy is that? So, first generation Zerona versus the Verju. At the time of doing this, Erchonia basically thought that by using the same delivery mechanism, the 635 laser, that they could achieve more significant results by developing something that was more energetic in terms of 532 wavelengths. So they were prepared to go and do all of the research necessary to prove it again. But according to the FDA, there was no need to do the further studies because they had already done the studies. And if one method of action was the same to the other method of action, then consequently, the study was already done. So more studies. So here again is when you take the baseline of the green and the red and you compare them one over the other. This is the red laser. There's your green laser. 25% more efficient. So the conclusions in terms of fat cell management, there you go. There's your patient before. There's your patient after. There's your 10 treatments in 5 weeks. Not only have we made somebody look better from the outside, they have all of the internal benefits, all of the elastins, collagens. They have everything inside themselves, now looking as beautiful as they did on the outside. And the only person they have to thank for that is their body's own chemical processes, because we are the drug. We just need the inspiration. When we talk about pain, we talk about prehab and rehab. As I already did, we bring everything very simple to you. So if I'm going to teach you how to use these devices, it's very simple, because if we're going to use pain, we're going to look at our dermatomes. So that's a basic dermatome chart. So we treat the dermatome first, then we treat the area of the pain. This is a patient who came to us looking for amputation, because in my team we have quite a large team covering a number of specialties, and she had complex regional pain syndrome. She had had it for years and years and years, and the pain was so bad she finally decided it was time to get rid of it. So I said to her, look, can we not try this laser first? We did, as you saw in the week before's lectures, if you were following it. And this is what happened. No more complex regional pain syndrome. There's your before and after pictures. You could argue it's a different hand. Just look at the apexial shape of the thumb. Look at the vein structure on the hand. The conclusions in pain, because this guy we treated for a plantar fasciitis, and you can see what he said. He had suffered with debilitating foot pain on and off for over a year. Had I known about laser, I would not have had to go through what I did. Margaret, with her complex regional pain syndrome, stole years of my life. I thought that amputation was the only choice. Then she found a laser. Whiplash. Whenever I hear whiplash, I think ambulance chases and all of that sort of thing, but whiplash is a real injury. But somebody ran into the back of this woman, extensive pain, depression, all of the things that accompany pain. She was told she had to live with it. She had laser. Her simple statement was, I don't. So we're talking about light. We're talking about amplification of light. We're talking about light amplification by stimulated emissions of radiation. We're talking about light that is totally non-thermal. Welcome to the future of medicine. Maybe it's time for you guys to think about lighting up your practice. Or if you like, stay in the past. This is the collection of devices that Erchonia have. And if any of you live in Ireland, we used to have a late night program called The Late Late Show. And they often had giveaways. We don't have any giveaways at the moment. Well, Simon will tell you we do. But he used to say, there's one for everyone in the audience. Look at those devices. There's one for everyone in the audience. Just think of what they can do. And when you think about it, just remember one important thing. Is it possible that our bodies have everything they need for life and health? The only thing missing is the inspiration to function. Thank you for listening. I'm Robert Sullivan, and this is Erchonia. Back to you guys.
Thank you very much for that, Robert. That was extremely insightful, and it fits in very well around our infrastructure and our strategy regarding education, because there is a lot of uncertainty out there that we come across as to what low-level laser is, and frequently we've come across clinics who thought they had true low-level laser, but it was actually LED, or it was infrared, or it was something like that. And being a research and development organization, all of our studies that we do are level 1, placebo-controlled, double-blind, randomized studies, multi-center, with no adjunct therapies, no lifestyle changes. We want the data given to be just the effects of the laser. So whether the laser's for fat loss, cellulite, pain management, treating fungal nails, we have the necessary amount of data to give reassurance to our clinics, our doctors, and their patients, so that they know they're getting the safest treatment possible, but also the most effective. Right, let's have a look at some questions. There is a couple here, Rob, for you. Firstly, can fat cell management liberate fat stored toxins, e.g. heavy metals?
I think because of the research we have and because of the processes around that research, our fat stores lots of things. I mean, it stores chemicals, it stores vitamins and minerals. It basically stores things that we don't want. But because of the way the fat is emulsified, you'll find that all of these nasties are actually enveloped or enveloped in this emulsified fat, and that they are passed out of the body through phagocytosis. So when you think about it, if you're going to have a heavy metal which is fat bound, effectively that's going to become tricyclic, so it's not going to stick to pretty much anything else because of its specificity. So as we move around, the fat that we need to fuel muscles will be taken. That fat is basically going to be taken up through phagocytosis, and it's going to be excreted that way as a result. So I have yet to see any negative study or any negative impact in terms of that. So yeah, you will get a release of stuff like that, but because of the process around that, it's not going to cause any negative effect to the body itself.
Yeah, thanks for that, Rob. Erchonia have done a lot of research in the US on their original Zerona model, looking at all sorts of things to show a reduction in cholesterol, to show that the fat that was being released from the laser doesn't enter the bloodstream. They have a study to show leptin levels, and also a systemic effect showing that the transportation of fat from the cell doesn't go to other parts of the body, but is actually siphoned out through the lymphatic system. So a lot of these studies that we've done, and there's also third-party studies, back up what Rob says, and what other of our more of our customers say as well. Another question, Rob: are liver function tests affected in those undergoing fat cell management?
No. That was actually a slide that I was going to pull in, and I thought to myself, if I pull that slide in, we could do a whole lecture on this. I think basically take a step back and think about the action of this laser. Okay, we're talking about something that's probably the healthiest treatment available on the market today, possibly. And the reason for that is, as we age, we apostatize, our cells apostatize, and things change, and they don't function the way that they're supposed to function. What we know from the research that I presented to you today is that these lasers that we're talking about, they actually restore, regenerate, and rejuvenate cell function. I have seen remarkable things happen as what I would refer to as positive side effects of these lasers. Like I had a patient unusually that had Hep C, and she had a huge liver issue, and she came with a weight issue. So we hummed and hawed, should we do it, shouldn't we do it, should we do it, shouldn't we do it? This was in the early days before I understood a little bit more about the photochemistry of this. And the condition she had was causing her liver to be more fatty than it would be, which again was unusual for the condition that she had. After she'd had a course of these treatments, she'd lost a lot of weight. But the problem she had with her liver, the hepatitis was still there, but the problem she had with her liver had completely gone, and it completely changed her lifestyle. I think when we look at some of the studies around leptin levels and other things like that, we basically see no residual effect on the liver at all, because you've got a fat that's basically released in such a way that it's totally usable by the body. Anything that isn't used is going to be put out through phagocytosis. And anything that's left after that is basically going to be restored by the next available fat cell. So I wouldn't worry about stuff like that. If you want to have the research on it, let me know and we'll get it out to you.
Thank you for answering that, Rob. Let's have a look. There's quite a few thank yous. Thank you for another show. Amazing. Glad to hear your presentation again, to remember all these things. Come from the Czech Republic. From Russia. Great voice, very persuasive presentation. Thank you very much. Do Americans have follow-up for the Zerona patients in a 5-year period or any other laser?
I do. I have follow-up. I mean, like, my clinic is very strange insofar as we're heavily computerized, and research and development has been something that I've always done. Now, I follow my patients for a minimum of 5 years. And because everything is computerized, we can actually audit that. Now, the FDA clearance on these fat lasers is non-temporary. And that's very important because it's really the only device that has a non-temporary clearance. And the reason that that's important is if I take you to theater and I do some liposuction and you don't sit back from the table, all of that weight is going to come back. When I was teaching first, I would basically say, take away a fat cell, it doesn't come back. What we know from research now is you take away one fat cell, you damage one fat cell, you're going to get 3 more. So that basically means that your storage capacity is 3 times more than it was before the intervention. When I follow my patients through this, I don't really see, I think probably, let me just check. When I follow my patients through, I think if I take 2 years ago, because I have figures here from 2 years because we only did it a few weeks back, of the patients that we saw in that time, only 3 of them have come back because they needed to lose more weight. An examination of that basically was their lifestyle diet, which really went back to worse than it was the time before. Of the other people that do this, remember what you're doing with these lasers. Again, from research, the research tells us that we are allowing our bodies to behave in a way that they used to behave. So we're causing this restoration, regeneration, rejuvenation. So basically, it's not a license to go out and eat the way that you did when you were 18, but it basically means that if you do go out and eat the way that you did when you were 18, because of what has happened with your cells, you're better able to handle that. But I think if you put anyone into a program that's going to run over a number of weeks, the first thing that happens is you are creating a habit in them to behave in a certain way. The laser is basically giving them back something that they haven't had for a long time, and they're going to value that. And when you follow patients through with that, I mean, I would say to my patients, look, if you feel you're slipping, come back, have another 2 sessions, and support them through it. Because if you support a patient through a program which is going to last anything from 4 to 10 weeks, they are going to have a lifestyle change. And the whole thing around fat cell management is basically to create an experience of confidence for the patient. And by creating that experience, you allow them to facilitate that change onward going. And I think what we do with our devices when we're training you is we teach you or encourage you to create that experience so that your patient doesn't fall back into that rut. I don't know any of you that know me. I was 50 kilos bigger than this. I've used these lasers. I mean, have I fallen back? Simon's known me a long time. Probably over the last 10 years, I've probably fallen back twice, but it's very easy to come back from there. So you're working with a device that gives you a non-temporary change. So, I mean, it's a change for as long as you want it. You haven't damaged the fat cell, so you're not creating more storage. I don't know if that
Thanks for that,
answers it.
Rob. Yes, it does. I'm glad you pointed out about the non-temporary change. So it's like anything. I mean, Robert treats a lot of obese patients in his clinic, where there is a lot of doctors out there who just do body sculpting, just do body contouring type procedures. Now, obviously, the rules that they follow are slightly different to the rules followed by the obese patients. But as a clinic, as people, we all try to lead healthy lifestyles and keep on with the healthy eating. But we'll all from time to time slip back into that process. So this obviously enables you to treat patients over the course of the year if they do fall back into that lifestyle. And I'm also glad Robert mentioned the word experience, because what we tend to do is we don't sell a Verju laser or a Zerona laser. We sell an experience, and our clinics who have it sell an experience. And this experience isn't just about aesthetically looking better and losing fat or circumferential reduction. It's about the whole host of health-related things that Robert brought up in his presentation before. They're really getting an overall picture. And the way we explain it quite a lot, especially in the medical aesthetic world, is, you guys do a fantastic job making people look younger and looking better from the outside. But I always think that masks how they actually feel on the inside. So having a treatment with the laser not only provides an anti-aging effect for them, they will feel a lot more energy, they will feel they can accomplish more, and they will actually feel healthier. So maybe then they will actually start feeling on the inside how they look on the outside. Sorry, Robbie, you were going to say something else?
Yeah, I was just going to say, like, from our point of view, we treat 38,000 patients a year across 32 settings and 3 private hospitals. And not all of those patients obviously are laser patients, but a huge majority of those patients are laser patients. And, I have a relationship with these patients as a medic that I never had as a medic with a pill box and a prescription pad. And, I think the way this technology does 2 things. The first thing that it does is it gives me back my medical practice, because it allows me to become the communicator, the medic that I was trained to be. The second thing it does then is it gives me something that I never had, or something that I seldom had and probably hardly ever saw. It gives me patients that smile. It gives me patients that are happy. It gives me patients that feel better. And when I say feel better, it's a strange feel better, because the patient walks into the room and you can feel their betterness. And I think for me, the way I practice now compared to the way I practiced back in 2012 when I met these guys, I mean, all I can say is I don't go to work anymore. I go to play. I go to have fun. And I think any of you guys that have these devices, I think you would say the same thing. It gives you the joy of care back. Anyway, I'm waffling.
Thanks, Rob. No, not at all. That's very interesting. One last question I think here is, am I right in thinking that most other treatments destroy the fat cell? For example, cryolipolysis, ultrasound, etc.?
Cryolipolysis, yeah, it damages fat cells. I've treated patients here that have had cryolipolysis, and we've had to treat them surgically because of the damage that has been done. Like one of the contraindications for any form of cryotherapy, be it me freezing a HPV or something like that, is diabetes. And if you think about it, if you have somebody that has a weight issue, there is an above average chance that that patient is going to be diabetic. And then, you know, if one goes and sticks cryolipolysis on those without doing the necessary HbA1c checks, you're liable. You know, so the thing I like about non-thermal low-level lasers is I took an oath, and you know, I swore by Hippolytus and Hippocrates that I would first of all do no harm. For the last 11 years, as far as a laser goes, I would like to think I have done no harm. So yeah, cryolipolysis, it damages fat cells, radio frequency damages fat cells, HIFU damages fat cells, among other things. So, you know, I think as a world, as a planet, as a profession, a healthcare profession, we're moving more and more and more towards treatments that do no harm. The problem you have with treatments that do no harm is if you're going to get into bed with a company that says their treatments do no harm, do your research. I have. That's why I'm here.
Yeah. One more come in actually there. Can you use Verju or Zerona with other adjunct therapies?
Of course you can. Why can't you? I would choose carefully the therapies that I would use them with based on the outcome that I was looking for. So even though I said, you know, radio frequency damages fat cells, let's say I have a patient that is quite obese and we're having difficulties in getting skin tone back, then I would use a combination of radio frequency and Zerona or Verju to basically create the outcome that I wanted. I wouldn't do them on the same day, but I would set them up where I would do one treatment, let's say Monday, I would follow it up with another treatment with the other device on the Wednesday, and maybe see how they were doing on the Friday. So yeah, you can combine it. I mean, excellent combinations there would be things like if you get these lymphatic drainage suits and you stick a patient on them, let's say for 2 weeks before you start them on a Verju treatment, you're going to see absolutely staggering, ridiculous results. Because you're conditioning the body. So, you know, stick them in one of these pressure suits, get them to increase their fluid balances. You're going to see changes as a result of those fluid changes. Now you stick a Zerona in there, and you're going to get 25% more than you would get otherwise. It's the same, you know, people will say diet. If I do the diet or the lifestyle changes you're talking about, I'm going to lose weight anyway. Yeah, of course you are. But now you stick the Zerona on that, you're going to lose 25% more weight in 25% less time for 25% less effort.
Okay, thanks for that, Rob. There's one which says, what price is the Verju laser? But
I have no idea.
After this webinar finishes, our main focus during this period is to educate, because I think there is a lot of people out there that don't quite understand it and don't quite understand the benefits. So that's the whole point of getting the likes of Robert Sullivan here, Rob Silverman, Kurt Gare, and a few of the other guys from the US on board, just to try to you know, instill more education. So, you know, if you're going to make an investment into something, you're educated to know what you are investing in. So on that note, there's a few thank yous for you there, Rob. And a thank you from me for your time and your enthusiasm, and also a thank you for everybody taking time out of their day to come on this webinar. Hope everybody is staying safe.
Simon, before we go, you guys out there that are listening to me waffling, if you have anything that you want me to talk about, be it in pain management, be it in obesity management, be it in fat cell management, whatever, if you've got anything that you want me to talk about that involves a laser, send the email into the lads in the office. They'll send it to me. We'll do a presentation around that for you. And if you're willing, we'll even get you involved in that presentation.
Yeah, thanks, Rob. That's great. And something what we will be putting on the emails out to anybody, if there's any topics that anybody wants discussing, you know, we can, we're more than happy to deliver them. So thanks again, and stay safe and well, everybody. And we look forward to you tuning into the next one. Thank you.